I'm Dr. Sri. I'm a board-certified family medicine and sports medicine doctor. And in this video, we're going to discuss why patients with diabetes are at increased risk for developing tendinitis or tendinopathy and how to prevent these conditions. So let us first understand what is tendinitis or tendinopathy. So tendons are structures that connect muscles to bones, transmitting the forces generated by the muscle contraction to facilitate the movement of the skeleton. We have numerous tendons in our bodies. For example, the rotator cuff is a group of tendons in the shoulder that connect to the shoulder bone and they assist in moving the shoulder. Another example is the patella tendon, which extends from the bottom of the kneecap, which is the patella, to the top of the tibia, which is the shin bone, while the quadriceps tendon that is located just above the kneecap connects the quadriceps muscles, and they both serve to extend your knee. The Achilles tendon, which is the largest tendon in the human body, they connect the calf muscles, the gastrocnemius and the soleus, to the heel bone, which is the calcaneus, and they play an essential role in walking, running, and jumping. The extensor tendons in the elbow, they facilitate movements of the forearm, particularly in extending the wrist and fingers, and these tendons originate from the muscles of the forearm and attach to the bones of the elbow and wrist. And finally, the gluteus medius tendon, a critical part of the hip's musculature, they connect the gluteus medius muscle to the femur and is vital for stabilizing the pelvis during activities such as walking, running, and standing on one leg. So these are just few examples of tendons that can become tendinitis or tendinopathy and can cause pain. For example, if I have a rotator cuff tendinitis or tendinopathy, I'm going to have pain with any overhead movements. So let us say if I've got like a quadriceps tendon, so basically a tendon in my knee or patella tendinitis, that's going to present as pain while running or walking and so forth. So let us say we talked about the gluteus medius tendon, which is the tendon on the lateral aspect of the hip, and that can, if that develops tendinitis or tendinopathy, then it's going to hurt when I try to walk or try to climb the stairs and stuff like that. If I develop tendinitis or tendinopathy in my Achilles tendon, which is at the bottom of the leg, that can present as pain when I try to walk, again, prolonged walking, or sometimes even people can have pain with first step in the morning as well. So some people will have tendinitis around the elbow, around the lateral aspect of the elbow, which we call it as a tennis elbow, and that can present with pain when doing any kind of gripping activities or trying to bring your wrist into extension and things like that. So now let us understand how one develops tendinitis or tendinopathy. So we load our tendons daily. For example, if I jog every day, my tendons in my knee, my tendons in my ankle, they adapt to the load and thereby they cause no issues for me. But let us say I gain weight over 6 months. Now this is going to increase the load on the weight-bearing tendons, basically Achilles tendon, the quadriceps tendon, the patella tendon, and thereby they start to increase the risk for tendinopathy. Sometimes an individual may drastically increase the training and thereby loading the tendons without providing adequate time for recovery and adaptation. So basically, according to the tendinopathy model, so you load the tendon, we cause some micro damage to the tendon, and then our body repairs the tendon, makes it stronger, and then we start to load more, and if we provide adequate time for recovery, we don't have any issues. But let us say, if we load the tendon, we don't provide enough time for recovery, then the tendon goes into a more like a tendon disrepair, and if one continues not to provide any time for recovery, then the tendon can go into degeneration, and this is when we call it as a tendinopathy. So the reason we use the word tendinopathy rather than tendinitis is because tendinitis means that it's inflammation, whereas tendinopathy means that there is a little more degeneration, and that's what we see in the microscope, that there is more degeneration, there is more chronic inflammation rather than acute inflammation, and that's why we don't use the word tendinitis and we are actually using the word tendinopathy nowadays. So far we have discussed how loading, which is more of a localized issue that affects tendons. But are there any systemic issues in a body that can increase the risk for tendinopathy? Unfortunately, this is where diabetes comes into play. So diabetes can play a role in recovery. So what that means is that if I load the tendon, the diabetes can affect the recovery of the tendons. At the same time, the diabetes can also cause a tendon disrepair as well, so basically causing degeneration of the tendons, and thereby all these factors are going to increase the risk for tendinopathy in patients with diabetes. So patients with diabetes are at increased risk for adhesive capsulitis, also called as frozen shoulder, Achilles tendinopathy, rotator cuff tendinopathy, trigger finger, gluteus medius tendinopathy, and many more. So do people with diabetes automatically face a higher risk for tendinopathy? And the answer is quite complex. But so far studies show that the tendinopathies are more associated with higher blood sugar levels. So this is good news because if one has diabetes, but if they keep their blood sugar in a controlled range, the risk for tendinopathy goes down. So beyond blood sugar, there are several factors that can contribute to the increased risk for tendinopathy as well. And most of the research has been focused on type 2 diabetes because the pathogenesis of type 2 diabetes is not just only based on high blood sugar alone. So what that means is that people with type 2 diabetes can also have insulin resistance. They can also have increased adiposity. And we know that the increased adiposity, which is basically increased fat around the waist circumference, that can cause chronic inflammation as well. And we know that some patients with type 2 diabetes also have weight problems as well. And this excessive weight can also increase the loading in the tendon and thereby increasing the risk for tendinopathy. So one factor that is common to both type 1 and type 2 diabetes is elevated blood sugar that increases the advanced glycation end products. Advanced glycation end products are harmful compounds that are formed when proteins or fats combine with sugars in the bloodstream through a process known as glycation. This process can occur naturally in the body, especially as one ages, or through dietary intake, but its rate can significantly increase in conditions like diabetes, where high levels of sugar circulate in the blood for prolonged periods. So the advanced glycation end products are problematic because they can damage surrounding tissues by promoting inflammation and oxidative stress. In patients with diabetes, we use a test called as the HbA1c, which measures an average blood sugar in the last 3 months. So the HbA1c test also provides the amount of circulating advanced glycation end products as well. So we know from studies that there is a good evidence to show that high HbA1c levels are associated with higher rates of complications in patients with diabetes. It is essential to understand that while HbA1c is one form of an advanced glycation end product that is related to blood glucose, it does not represent the totality of the advanced glycation end product burden in one's body. So what that means is that, for example, a person can have an A1C of 6.5 and they could have a pretty healthy diet, and thereby the overall the advanced glycation end product burden might be low compared to someone with the A1C of 5.7, and even though their HbA1c might be lower, so the advanced glycation end product related to blood glucose might be lower, still the totality of the advanced glycation end product burden might be higher if the person is following an unhealthy lifestyle or the person is smoking and so forth. This discrepancy occurs because the advanced glycation products can accumulate in the body through various mechanisms and not just through the glycation of hemoglobin, and factors such as diet, smoking, and inflammation can all influence this accumulation. So the general consensus at this point is that if your HbA1c level is more than 7, it basically means that there is an increased burden of advanced glycation products and thereby increasing the risk for complications that is associated with diabetes. Right now, direct measurement of total advanced glycation product burden in one's body is not a standard clinical practice. Although in research studies, they use like skin autofluorescence to detect the total ages in our body. But what we have to understand is that these advanced glycation products can interfere with tendon recovery and healing and thereby increasing risk for tendinopathy. Elevated cholesterol is often found in individuals with diabetes, and we know that the high amount of triglycerides might also be playing a role in increasing risk for tendinopathy. So we also know that people with high cholesterol, they take a medication called statin, and statin have been implicated in the risk for tendinopathy as well. So the statins are so important in helping manage one's cholesterol and decrease risk for heart disease. However, in some patients, they do cause problems. So that is why, let us say if one is taking a medication called a statin, you have to discuss with the doctor to see if the statin could be implicating the risk for tendinopathy. It doesn't mean that if let's say if the chances are the statin is causing tendinopathy, we don't have to completely stop the statin, so one can decrease the dose and see if the tendinopathy resolves, or sometimes we can change to a different statin medication and then see if the tendinopathy resolves. But we also have to understand that the risk for heart disease is high in patients with diabetes, and statins can be a lifesaver in these patients. So we have to come up with a solution where we try to mitigate the risk for tendinopathy. At the same time, we also try to decrease the risk for heart disease as well. In my clinical experience, I manage a lot of patients with tendinopathies, and they can be very disabling. For example, I have a patient with a frozen shoulder, and it's been almost 2 years of disability, and she has had multiple injections to improve the quality of life, and it's after 2 years she actually eventually regain her full range of motion in her shoulder as well. So this is just to highlight that they can be very disabling. Therefore, prevention is more important than cure. So here's my advice to prevent the risk for future tendinopathies. So let us say if you have type 1 or type 2 diabetes, making sure that you keep your blood sugar in range is so important. So I see a lot of patients with type 2 diabetes with an elevated blood sugar, and they might say like, I want to try lifestyle modification for maybe 6 to 9 months before starting on a medication. The problem here is that the person might take like 6 to 9 months to implement those lifestyle modifications to see a change. But for 6 to 9 months, the person is at increased risk for complications of tendinopathies and other complications that associate diabetes as well. My advice to patients is to be more aggressive getting the blood sugars under control, implement the lifestyle modifications at the same time, and then it's always easier to come off the medications in the future. In addition, regular exercise, including both aerobic and resistance training, can be extremely beneficial for patients with diabetes as it helps reduce multiple risk factors associated with the condition. For example, in patients with type 2 diabetes, it also helps with decreasing the risk for obesity, high cholesterol, and high blood pressure as well. Exercise enhances your blood flow and it improves tendon healing, it strengthens the tendons, and it significantly improves the blood sugar control while reducing that blood sugar variability, all which decrease the risk for diabetes complications. So those new to exercise, I recommend starting slowly and gradually progress. For example, one might come and tell me that they want to start jogging for 30 minutes to improve that blood sugar. But the problem is that we know that when people with uncontrolled diabetes or people with concurrent weight issues, they may not be able to recover from a tendon load after an exercise bout. So this means that we have to provide sufficient time for recovery. So let us say if one is jogging for 30 minutes straight, then they are putting a lot of stress to the tendons that take part in jogging. So for example, you're putting a lot of stress on the Achilles tendon, you're putting a lot of stress on the gluteus medius tendon, and thereby increased risk for tendinopathy. Instead, what I'll tell people is that you should probably try to do exercise where you can distribute the load. For example, one can do 10 minutes of walking, 10 minutes of biking, and 10 minutes of elliptical, and thereby you distribute the load to the tendon and thereby decrease in risk for tendinopathy. Sometimes if you have trouble finding the perfect exercise for you, then I would recommend consulting a knowledgeable physical therapist that can help with your journey as well. So resistance training, or also called as strength training, it plays a vital role in overall health. So resistance training significantly contributes to increasing both muscle and tendon strength. Once you enhance the muscle strength, this can lead to reduced load on the tendons and thereby potentially decreasing the risk for tendon stress and injury. Furthermore, resistance training can directly increase the strength of the tendons themselves. For example, exercise like squats, they are effective in strengthening the proximal muscles and thereby decreasing the load on the Achilles tendon. And this way, you can decrease the risk for tendinopathies. If you're completely new to resistance training or strength training, I'll link the video at the end of this video to get started with resistance training. Additionally, maintaining healthy cholesterol levels is important. So some patients might need medications to control their cholesterol. Some patients can just incorporate healthy lifestyle and thereby improve their cholesterol as well. I usually advocate for a diet that is centered on whole plant-based food, though this does not necessarily mean that one has to exclude meat entirely. An anti-inflammatory diet approach can be very beneficial in reducing the risk for tendinopathies. So basically, this diet focuses on foods that combat inflammation-causing chemicals as well as limiting the foods that promote inflammation. So basically, this includes a variety of fruits, vegetables, whole grains, beans, lentils, nuts, seeds, and healthy fats such as olive oil. It restricts the intake of saturated fat and trans fat, refined carbohydrates, and excessive animal protein. By basically following an anti-inflammatory diet, you decrease the burden of the advanced glycation products, you decrease the risk for chronic inflammation, and all this will make sure that you're going to decrease the risk for future tendinopathies as well. So I'm going to link a video at the end of this video on how to get started with an anti-inflammatory diet. Adequate sleep and managing stress levels are also important for achieving better blood sugar control. Incorporating meditation can be a valuable tool for stress management, and for those interested, I'm going to provide a link to a beginner's guide to meditation in the description box below. So bear in mind, while diabetes can certainly increase certain health risks, adopting the strategies that we talked about can effectively combat these risks and improve your quality of life. So I hope this video was helpful. If you have any questions or comments, please post in the comment box below. If you want to know how to get started with the strength training, then check out this video here. If you want to know how to get started with an anti-inflammatory diet, then check out this video here. And I'll see you in the next video. Until then, goodbye.